Good afternoon. Mike Jones here at City Council Chambers again to talk to you a little bit about some things going on in the city of Fredericksburg and a little bit about COVID-19. Unfortunately, the Commonwealth of Virginia's website is down and they haven't been able to release the latest statistics from yesterday related to the COVID-19 in relation to deaths or testing or anything like that, in the same situation with the local health district. If we get those numbers today, we'll provide them in our written report. As of yesterday, we were at 629 cases total, and we had 45 total cases in Fredericksburg. We had not had any new cases as of yesterday at noontime. There are still only 2 outbreaks in the entire health district. One of those was in Spotsylvania County at a grocery store, the other one in a long-term care facility in King George County. We do have, unfortunately, 45 healthcare workers in all various parts of healthcare that have been tested positive for COVID-19, but testing continues to ramp up, and we're also looking at being able to have antibody testing done starting next week through the hospital. Statewide, we're still looking at the trend being flat as of yesterday, so I think we'll be okay there. Let's talk a little bit about the governor's order, executive order number 53, and the fact that it appears that come May 15th, a lot of the non-essential businesses will be able to go back into business. As I mentioned yesterday, your city staff is working very hard to develop a plan where we transition the workforce back into the city offices and eventually open the city offices to the public. We had a meeting with that earlier today, and we're continuing to work on that, and hopefully we'll have that document ready for publishing sometime early next week. Don't forget about our local elections. Local elections for the office of mayor and city council will be on Tuesday, May 19th, 2020. There will be polling places in town so that you can vote in person, but also we're highly encouraging you to do absentee ballots. If you want an absentee ballot, you must request one no later than 5 p.m. on Tuesday, May 12th. That's if you want an absentee ballot, no later than 5 p.m. on Tuesday, May 12th, you have to request it. And then it has to be turned in no later than 7 p.m., that's the time the polls close, on polling day or election day, May 19th. So it has to be turned in by 7 p.m. on May 19th, 2020. So please don't delay, get your ballots and get those filled out and turned in. We want your vote to count. Let's talk about a couple of other things that are going on. I don't know whether you know about it or not, but May is Mental Health Awareness Month. So if you're struggling or having issues with depression or other mental health maladies and things like that, there are certain phone numbers and people that you can see. There's a local number for the local health district and thing that you can talk to people about, especially if you have stress related to COVID-19 or other issues in your life. But if you really have major struggles, you can always call the National Suicide Prevention Hotline. That number is 1-800-273-TALK or TALK. That's 1-800-273-8255. And finally, let's end on a positive note. You've heard a lot about the COVID-19 crisis and things that are going on, and talking about healthcare workers, whether they be first responders such as firefighters, EMTs, medics, police officers, sheriff's deputies, but we also have a pile of allied health officials and workers like doctors and nurses and things like that. And this happens to be National Nurses Week, and today is National Nurses Day, May 6th. National Nurses Day. So if you know a nurse or you see a nurse or you're out and about, make sure that you give them a high five or a virtual high five, let's put it that way, or give them a thank you. Just verbalize that to them and tell them thank you for everything that they're doing to help stem the tide of COVID-19. Hopefully we'll have those statistics to you later today, and if not, we'll talk again soon. Thank you.